Good afternoon, everyone. It is a pleasure to be here, and my name is Crystal Lander. I'm the Chief Strategic Engagement Officer at Pathfinder International, and what a great way to kick off this program by hearing directly from the people that are most at the center of all the work we do, which is women like Margaret. As you could see from the video, Margaret is in Nairobi, Kenya, and she is a community health worker. She's an advocate, though. She wants to make sure that's clear. Some of the work that she's doing is advocating for payment for health workers in her country. Now, there has been quite a bit of change in the way monthly stipends are distributed in the country. And while there has been a lot of change so that the Nairobi County passed a law to provide monthly stipends for community health workers like Margaret, a big part of it is making sure those community health workers actually get paid. So that's the part we have to worry about. So Margaret is doing the hard work, is making sure that the government is fulfilling the advocacy needs and the laws passed. So while this video focuses on community health workers, our event is focused on all frontline health workers who are the backbone of a health system. It is critical that they are supported for global health security, and they provide accessible and essential health services in every community. We will highlight the support still needed to ensure that they can do their jobs effectively, particularly as the COVID-19 pandemic still exists and has exacerbated already existing challenges. Here are the numbers. There's currently a shortage of 15 million health workers around the world, particularly in Africa, parts of the Middle East, and parts of Asia and the Middle East. 70% of health workers are women like Margaret who face additional social and economic challenges, such as unsafe working conditions, harassment from peers or patients, unequal pay, occupational segregation, and discrimination in education and training programs. Women contribute $3 trillion, with a T, dollars in global health annually, half in the form of unpaid work. And at least 6 million women health workers are unpaid or grossly underpaid. Now, I heard this number this morning at a breakfast hosted by one of our colleague organizations, and every time I hear about the unpaid work of women, it surprises me we are still here years later after talking about this. So today, this event is focused on just that, making sure we do the work, not just talk about it. The Frontline Health Workers Coalition, along with several coalition partners, including the Global Health Council, IntraHealth International, Living Goods, Mother to Mother, Pathfinder International, Sabin Vaccine Institute, Smile Change and Women Deliver, with support from Chemonics, Global Community Health Impact Coalition, Johnson & Johnson, Last Mile Health, and Women in Global Health bring you this event today. And the reason why it's a lot of partners is because we wanted you to understand that this is not a I thing, this is a we thing. We have to work together to make sure we're doing this right. So we have a number of ministers of health who have joined us from Burkina Faso and later Tanzania, who will be a part of this great program. I now turn it over to the director of the Frontline Health Workers Coalition, David Bryden, who will introduce our keynote speaker. Again, good afternoon.